Assalamu alaikum wa rahmatullah. For this session, we will start with the Unit 3 within this semester, which is the lymphatic system. So we will discuss the lymphatic system and the function of the lymphatic system. The function, as you know, the lymphatic system, it is similar to the vascular system, and also it has the defense mechanism. So we will discuss both the function of a circulation, and there is some difference in the circulation, so we'll discuss it, and we will see the difference between the circulation in the blood vessels and circulation in the lymphatic system, and also the role of the lymphatic system in the defense mechanism of the body. For this lecture, our objective is to list the component of the lymphatic system and describe the structure of major lymph node, then describe the structure of the lymphatic vessels, and also describe the function of the lymphatic node like tonsils and thymus gland, Bayer patches, and spleen. So the lymphatic system, it is linked with the circulatory system, as we said, but it has difference between them, and linked with the defense mechanism. So it has both the circulatory, or it deals with the body fluid and circulation, and it deals with the defense mechanism and protecting the body from microorganism or invader, or from cancer cells and parasite and virus and other things. So in the lymphatic system, we have the component or the structure of the lymphatic system. We have the lymphatic vessels. The lymphatic vessels and also lymphoid tissues and organs. So the structure is divided to lymphatic vessels and the lymphoid tissue and organs. The lymphatic vessels, they are returning back the fluid which is escaped from the circulation in the capillary bed, in the arterial part of the capillary bed. Some of it will be reabsorbed by the venous part, the efferent vein, and some of it which will remain in the tissue, it will be recirculated or reabsorbed by the lymphatic vessels or the lymphatic system and return back to the circulation through the lymphatic system. So transport the lymphatic vessels, the function of them is to transport fluid that escaped from the vascular system, which is called the lymph. They will transport it to the blood or to the blood stream. After it is filtrated and after checking it for the presence of any pathogenic or anything that is considered as antigen and which will be prevented from going back to the circulation, and it will be trapped, or it might be attacked by the immune system. The lymphoid tissue, it is a house of the phagocytic cells and lymphocytes that are part of the body defense mechanism. So they are part of the body defense mechanism against any kind of invasion. So what is lymph? If we ask ourselves about the lymph, it is fluid. That fluid is coming from the fluid which is escaped due to pressure exerted in the capillary part, the arterial capillary part. So some of the fluid, it will be escaping to the tissue, carrying out nutrient material to the tissues, but that amount of fluid, it has to be returned back. So most of it will be returned back through the venous capillary or through the veins, and it will go back to the circulation. The amount which remaining in the body every day, it is around 3 liters that escape from the circulation in the tissue and will not be recirculated directly through the capillary, the venous side of the capillary. It will not be reabsorbed by them. It will be returned back by the lymphatic vessels. And after series of treatment, it will return back to the circulation. So fluid forced out of the capillary at the arterial end, and most of it is reabsorbed, as we said, at the venous end. So this is the lymph. It is a fluid which is forced out from the capillary at the arterial end, and most of it, as we said, it will reabsorb back by the venous end, but the remaining, which is about 3 liters per day. So the fluid which remain behind in the tissue space is around 3 liters, and any plasma protein must be carried back to the bloodstream. So how? By the lymph. The lymphatic vessels pick up this excess tissue or fluid, which is the lymph, which is a clear fluid, and retain it to the blood stream. Fluid, if the fluid accumulate and if the lymphatic vessels or the lymphatic system is not working well in the drainage of this fluid, it will lead to edema. So fluid will be infiltrating the tissues, it will be accumulating there, and it will cause edema in the tissues. The lymphatic vessels, it is a blind end lymph capillaries. So it is a one-way, a pathway for the lymph. Lymph capillaries are very permeable, and it has many valves. So this is the blind end of the lymphatic vessels, that at that end there is a flap-like mini valves that will permit one-way direction of the fluid which is accumulated there in the surrounding tissue to enter inside the lymphatic vessels and to go then to the lymph nodes until it reaches the circulation, back to the circulation. The wall of the lymphatic vessels, it is endothelial cells. It is formed from endothelial cell. There are here filament of which anchor it to connective tissue, so it will be fixed with the connective tissue. And here the fibroblast, which is those connective tissues which is coming around them. So this is the lymphatic vessels. This is the end, blind end of the lymphatic vessels. So it is closed end, but there is a flap of many valves that permit the fluid to enter directly inside when the pressure is more in the tissues. But if the pressure is becoming more in the inside the vessels, this will lead to closure of that valve. It will exert the pressure on that flap, and it will be closed and preventing the fluid from coming back to the tissues. So it will go in one direction. So a protein and large particles, bacteria also, virus, cancer cells, enter the lymphatic capillary easily. Because you know those flaps, the permeability of the lymphatic vessels is high, and also those valves are permitting even large molecule to come inside. It is not like the capillaries of the blood vessels. So the lymphatic vessels connection, as we said before, so this is the heart. The heart is pumping the blood through the main arteries, starting from the aorta, and until it reaches several body tissues. At the end of the arterioles, there are capillaries. In the capillaries, the pressure is higher. And you know that the capillaries, it has a one layer of tissue that increase the permeability and increase the ability of the nutrient which is carried out by the bloodstream and fluid to escape to the tissues due to the high pressure. Then the pressure here in the venous side, it will be low. So due to lower in the blood pressure here and increased pressure of the fluid in the tissues and osmolarity and also difference in concentration, this will lead that most of the fluid, it will be reabsorbed and go back to the venous circulation in order to go back to the heart. But as we said, some of those that fluid, which is totally in the whole body, around 3 liters per day, it will not be returned through the venous part or the venous circulation. So it will go back through the lymphatic vessels, and during its pathway, it will go through lymph nodes in order to be checked. It is similar to a checkpoint that it will not allow any harm thing or antigen to pass to the circulation. So it will be trapped there, and it will be either dealt with by the antibodies, or it will be dealt by the phagocytosis and phagocyte cell. It will destroy it and preventing it from passing to the circulation and causing septicemia or causing further infection. So this is the lymphatic system. This is the tissue fluid here. As we said, it will lead to formation of lymphatic fluid, and those are the lymphatic capillaries, as we said, and lymphatic collecting vessels. So the fluid will be collected here first, and then it will go to the lymphatic gland, while the process, as we said, of filtration of this fluid and preventing any antigen or any bacteria or virus or cancer cell to pass back to the circulation, and it will go then to the lymphatic duct, and from the lymphatic duct it will go to subclavian vein, and from the subclavian vein it will go to the circulation. It will go back to the heart and to the circulation. So the drainage of lymphatic vessels, as we said, it is drainage divided from the right lymphatic ducts and drainage from the thoracic duct. So either the lymphatic fluid, it will go through the lymphatic, through the right lymphatic duct, or through the drainage of the thoracic duct, and it will return back to the circulation. Here, the right lymphatic duct, it will be connected to the subclavian vein. This is the right subclavian vein. So this is the thoracic duct. Thoracic duct. It will return back the, it is also connected to the left subclavian vein. The lymphatic vessels, the function of the lymphatic vessel relate there in relation to its structure. The lymphatic vessel, as we said before, it has a very thin wall. That, because of that, it will lead to higher permeability. So it will lead to reabsorption or allowing the fluid which is escaped in the tissue to come back to the lymphatic vessels. The largest one, it has valve. Those valves, it will prevent, as if you remember when we discuss the veins. The veins, it has also valve that will keep the direction of movement of the fluid in one direction and prevent returning back of the fluid to the tissues. So the lymph is transported by the same mechanism as we said, the return of venous blood, as we said. So it has, if you remember the venous return, it has the valve, the vein is having a valve, and also, if you remember, there is the muscular action, a muscular pump, and also there is the pump or the pulmonary pump. So those are the skeletal pump, muscular pump, and respiratory pump is there, which is similar to the circulation or to the cardiovascular circulation or blood vessel circulation or in the venous system. Plus, rhythmic contraction of smooth muscle of large vessels. So the large lymphatic vessels, it has a smooth muscles on the wall of that large vessels, and that movement of the of that smooth muscle, it will also help in returning back of the fluid to the circulation. What's happened to bacteria and virus and cancer cell that enter the lymphatic system? We said that the permeability is here. The lymphatic vessels can also permit the entrance of bacteria, protein, and large molecule. Because of that, and those large molecules, it will be processed before it goes back to the circulation. So in the lymph node, it will be either phagocyted or it will be attacked by the antibodies in the lymph node and to kill those organisms. So lymph take or the deters through the lymph node, where it is cleaned of debris and examined by the cell of the immune system. So as we said, the lymph node, it is like a checkpoint. in that lymph node, everything, it will be checked before it is going up to the next lymph node and to the next lymphatic vessels. And if bacteria or cancer cell is there or any harm cell is there, it will be trapped there and phagocyted, treated there before it is passed to the circulation. طبعا it will not pass as a bacteria, or it will pass as after destruction of it, as a waste product. The lymph node, it protects the body by removing the foreign material, so it is filtrate the lymph. So it will lead to filtration of the lymph and preventing any material from going back to the circulation, as we said, by the lymph node. It contains macrophage that engulf and destroy the bacteria. Macrophage, yes, it is present in the blood, but it will escape from the blood and it will immigrate to the lymphatic tissues, and it will go to the lymphatic tissue and destroy the bacteria inside the lymphatic tissue. It contains the lymphocyte which respond to foreign substance. So, and where are the lymph node most dense? The lymph node is most dense. If you see this diagram, here we have axillary lymph node. Here we have the patches, pair patches, and near the intestine, and here in cervical lymph node. So it is those gland or those lymph nodes are accumulated there in order to clear the fluid or the lymphatic fluid before it is going up and reaching or beside or going toward the circulation. So why do we have had a swollen gland during any infection? If you remember in this session, we said that the lymph nodes and or glands, they are trapping the infectious material. Any bacteria or virus, they are trapping it there, and they are doing phagocytosis or fighting the infection there with the phagocyte and with the antibodies. So due to that, there will be inflammation and there will be swelling of the site until the infection is resolved, and then it will return to normal. So the lymph nodes, we have here, those are the inguinal lymph node on both sides, right and left inguinal lymph node. We have the axillary, as we said, axillary lymph node on both sides, right and left, and cervical lymph node is there. So those are the main collection of the lymph node in our body. The lymph node structure, it is like a kidney shape or peach shape. So if you see here, there are the afferent and efferent vessels, and this is the capsule of the lymph node, and this is the trabeculum of the inside the lymph node. The afferent lymph vessels are more than the efferent lymphatic vessels. The afferent, that the fluid is coming through toward the lymph node, and the efferent, it is the fluid, the lymphatic fluid, will go toward the other lymphatic vessels or toward until it reaches the circulation. Why they are the number of efferent vessels are less? In order to make the movement of fluid inside the lymphatic node slow. So by that, the lymphatic node, the lymph node, will be able to check every cell, every minute component of that fluid, and to treat it before it reach the efferent vessels. So it will be treated before that. If it is passed, it will go to other also lymph node that will do more filtration. So those are the efferent lymphatic vessels, and those are the iris, which is similar to the kidney, and here the cortex of the lymph node, and the medulla. The cortex follicle, which houses the lymphocyte, which is the resistance part, or which which will kill the microorganism there and preventing them from passing to the circulation. B lymphocyte also, plasma cell, which is related to the antibodies that will attack the antigen if it is there. B lymphocyte and T cell are lymphocyte in transit circulate continuously between the blood and lymph node, and also lymph stream surveillance during the surveillance. So they are moving the T lymphocyte between the blood and the lymphatic system. Also, it has here the phagocytic macrophage are located in the medulla. So the macrophage that will engulf the bacteria and destroy it. Engulf the bacteria or virus or the cancer cell and digest it and destroy it. Lymph enter the convex side through the afferent lymphatic vessels, as we said. So, and then the lymph flow through the number of sinuses inside the node. The lymph exit through the efferent lymphatic vessels, and fewer efferent, as we said, than the afferent vessel, which caused the flow to be slowed, and we mentioned why that we needed to be slow in order to fight any abnormal cells or any bacteria or any foreign body or antigen that passes through the lymphatic fluid to the lymph node. Then we have lymphatic organ. The lymphatic organs, we have the spleen as a lymphatic organ, which is as a curve around the left side of the stomach, and most of the destruction of red blood cells, it is happening in the spleen after it is completing its lifespan. So it filter and clean blood of bacteria, virus, and debris also, or any end product of destructed bacteria or virus, destroy worm out red blood cells and return some part to the liver, like the iron, in order to produce hemoglobin. Rest is excreted in the bile. So after destruction of red blood cells, it will be this two parts, the heme and the globule. That will return to the liver, and the liver will either store the iron to be reused by the blood vessels and the building of new red blood cells, and the bilirubin, which will be some of it will be excreted through the bile. During hemorrhage, it contracts if injury is happened. In this case, in order to maintain the circulation and prevent loss of or hypovolemia in the blood vessels, so the spleen will contract and empty the amount of blood which is there inside into the circulation. So it can be as a reservoir for the circulation to maintain the pressure of the blood pressure within the circulation by squeezing the amount of blood which is there in the spleen into the circulation. An important hematopoietic site also, or lymphocytes, are there to fight infection. So the lymphoid organs also, we have the thymus gland. Thymus gland, it is in the thorax, in between the lungs. The thymus gland, it is mostly active during youth age. It produces thymosin, and also T lymphocyte are produced there in order for the immunity. We will come later also for discussion of the immunity. So produce hormones, thymosin. The function is programming center or programming certain lymphocyte to carry out their protective roles, the T lymphocyte. So the thymosin, it will produce or help to program the T lymphocyte, which act against bacteria or which act as immune in the immune system. In the lymphatic organs, we have also the tonsils. The tonsils are present in the throat, in the pharynx, and the function of them is to trap and remove any bacteria or other pathogen entering through the throat to prevent it from going toward the circulation and to other tissue. And sometimes they become congested with bacteria and become red and with swollen, and thorus throat will be there, and tonsillitis. So it is due to trapping of too much bacteria there, which might lead to the infection. And in some people, if recurrently it is inflamed and accumulation or pus is accumulated there in the tonsils, in this case, sometimes they are doing tonsillectomy and removing those tonsils. But it's better always to treat the infection rather than removing the tonsils. The lymphatic organs also, we have the Bayer patches. Bayer patches, they are present around the intestine. So found in the small intestine, in the mucosa associated with lymphatic tissues, and also they are fighting and filtrating the fluid which is absorbed from the intestine from any pathogenic thing. They are attacking foreign matters entering from the digestive tract. So any foreign materials or any antigen which come out from the intestine or absorbed from the intestine to the lymphatic tissue, it will be attacked by Bayer patches. In next session, we will continue with the body defense mechanism, the specific and non-specific defense mechanism. Thank you.